Hello guys, and welcome to the next episode of Project Hospital. This time I'm already in the game, so let's get to it. So, last time, as I explained, I just basically showed to you how I kind of cheated and ended up with a hospital that actually already has hospitalization for uh, general surgery and also for neurology, with an ICU here and some ER general hospitalization, basic ER, what is the name of it? Observation here and some other stuff. Um, and we have started this thing here. Treat patients of control doctors in specialist mode, which is going to give us, well, the goal, what we get for it is not really important, to be honest. Uh, we are go hold on, just to make sure. Yeah, we are going to get for it 5 increased ambulance patients per day to 5, which is very interesting because that means that if I buy 2 ambulance here, and it says increase ambulance patient per day to 3, that will be a totally useless thing. So either this is going to be automatically jumping to something else, or I'm just wasting it like absolutely nothing here. But we already have 26 people uninsured who are coming anyway, so whatever. So enable hospitalization in traumatology is not our plan. However, we might end up having to do it, depend on having or not some people in traumatology who we need to, um, treat in a hospital, cannot treat in the clinic. So we'll see. Severe patients after one collapse. Up until now, I have 84 days in the game, and I had one collapse. Sorry, I had exactly one collapse. So far it hasn't been a real issue. So I don't know how that works. Okay, so we don't know yet. All right. Anyway, so what we're gonna do now, we're just simply gonna continue from here. For some of you guys, might be it's a bit grindy. I understand that, but it is what it is. This is part of the game. This is the previous one when we built this. I mean, I didn't show you guys how built it, but basically building the places and increasing the capacity and everything. That's more like a building game. And this place right now, what we're gonna do is more about actual, um, like the game as a, how do you call it? Like playing as a doctor, basically. So that is from the DLC, I believe, the Doctor Mode DLC anyway. So it's basically a DLC. I'm not sure how it works. We wouldn't have this kind of thing in the base game, I believe, but still, you can control people on the in the base game and everything. So I think it's fine. By the way, guys, if you are watching my different videos, you will see that some crazy things happened in my Ostriv, my village building thing. You will see it in the next episode. The one that I uploaded today, I mean, what I streamed today, nothing happened. But then you will see that I am right now, while I'm talking to you guys, I'm kicking myself or something. So stay tuned for that and come to watch the next stream of Ostriv when we do it. I don't know exactly when it's going to happen. Now, before we do anything, let's check in with our 2 special friends. Frank Anderson, I mean, I like this game that actually you can almost like really establish a relationship to your patients. So Frank Anderson, everything is nicely stabilized. We have the everything ready. We just simply have to keep treating him until they decide that okay, it's good enough and he can go home. Same thing, I believe, here in neurology. Lisa Hall, look at that. I know her name without even clicking on it. Lisa Hill. Okay, so I don't. Sorry. Again, same thing here. She's already in this very spacious, very loosely built uh, hospitalization area of the neurology department, and she's getting all what she needs. By the way, the way how the elevators work there is really good, as I showed you guys last time. So far, it works out really nicely how the elevators are specific to the department. So basically, there is no running around involved, I believe, between different departments. So that's cool. All right, why don't we just go and check out if there are any people who are waiting for me. Paul Harris here. Okay, I keep these two on. Frank Young and Michael Smith. I don't care about you guys for now. Sorry about that. Paul Harris is one that is waiting for me. Okay, we do have a lot of people in emergency. We have to remember that. Nobody in ICU. We have 3 in general hospital. One of them is Frank. Sorry, guys. I really don't know what happened. I keep yawning. I think maybe a little bit less oxygen than I need. So let me just open. Give me a sec. I just opened the window a little bit wider, so hopefully I get a bit more oxygen here because I kind of need it. Internal department, nobody's waiting for me. Good. Orthopedia, neither. Also not in cardiology. We have Lisa Hill here in the bed, but other than that, nobody's waiting for me. That's good. And traumatology, neither. Okay, so we are basically ready to jump into it. We only have Paul Harris waiting for us, and that's it. As you can see, we don't know how many hidden symptoms we have. And let's go, for example, this guy here, Paul Harris. We only know that he has chest pain, and we have 8 pages of possible exams. Everything is there basically, which means that we could end up giving people a lot of tests and a lot of shit that they really don't need. So that wouldn't be a good idea, would it be? All right, so let's get to it. He's waiting for me, so let's see. Oh, by the way, he's a cooperative. Nice. That's a nice thing. Uh, he has chest pain. Now, luckily, this one is still available for us. Since I'm not a doctor, this is actually a very helpful stuff. We already did physical, chest, temperature, blood pressure, thorax percussion, and speech listening. Okay, that's quite a few things that we have done. What should we do? What else should we do? Now, I'm actually thinking chest pain. Actually, Spiromet would be good that we can only do it in internal medicine. And as you can see, our problem could be general, cardiology, internal, emergency, traumatology, infections, practically anything. So I'm not going to do anything specific like that right now. Ophthalmoscopy, I don't think so. I'm actually thinking of doing a CRP test because that actually can sort out, if you can find it, because now it's really hidden behind everything. I haven't done a CRP test, did I? Oh, here you go. Sorry. It's right there in the beginning. Now, chest pain, I'm not going to check his ear, but CRP is good because it's going to check if he has some indicative of inflammatory and infectious diseases. So hopefully we can get those out. Let's do I'm not going to do an ECG at this moment yet. We are not doing any kind of big things. Uh, let's see what we could do. We could do an X-ray chest, but that could be a little bit too jumping, right? We did the speech listening already, so that doesn't. Let's just do a simple like oral cavity test, maybe. Let's do a neurological test. And how about abdominal palpation? Would that help? I'm not sure. Apparently, yes, like traumatology, it actually shows that he could have like burning or something because we don't know anything about him. So let's do an abdominal palpation and let's keep going now. Okay. Nancy Martinez, let's see what you have. And I keep taking a look at probably this one so that I know if it's my doctor or not. It's oh Jordan Young. Yes, this is my doctor. This one would count towards the specialist mode. Okay, so you have abdominal pain and weight loss. We already did a lot of things. CRP, blood pressure, pretty much the same things actually. But luckily we have much less possibilities. Excuse me. Now, okay. Have we checked your temperature? Yes, we have. Physical, of course we did. I mean, an ECG is always nice, but actually it's very specific, so I don't want to do that. Thorax percussion, I'm not sure that that helps. Basic visual testing, no need at all. You know, as you can see, it's basically giving you all the possibilities. That you see a chest pain, you know, sometimes when you have an abdominal pain, it could come also from there. So I would say let's do a thorax percussion. I'm looking for things that are very simple right now, so it's not gonna give him any trouble. He has a weight loss that doesn't sound so good. Have we done a CRP yet? Yes, we did, and it's not. It's negative. Okay. We don't want to do an autopsy. That's actually funny that you have an autopsy available as one of the. Yeah. Okay. We don't want to do that. No, 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 not yet. Not yet. Maybe a bit later. Uh, so what can we do here? Thorax percussion. I don't think so. You say this is like makes it right away much more difficult. Like it's so many different things that possible that we don't know. Now, I would actually do a CBC testing, have a complete blood count. That could actually be very good. We don't need that. There are like it's offering me things that I would never want to use. PCR sampling, no. Urine analysis. I don't know. I don't think it would be. his stomach that would be hurt. It would be hurting, So I'm really not sure about that. Oral cavity, would it help if you did any kind of oral cavity inspection? I don't see it. Serologic testing, yes. CBC testing, yes. And also serologic testing is apparently highly suggested. So since we already do some test on him, on her, I don't know why, but apparently I have to do like a ton of ECG all the time, and I don't really feel like it because I think it's a bit overdone. Okay, and the blood pressure we already tested. Let's do this for now. Let's try to find some easier customers. Okay, so this guy, everything is, almost everything is, what is it? Neurology other than this one. So let's see, for this one, we already have the temperature, we have the physical. Have we done a neck palpation yet? I believe we did, and it was negative. And ophthalmoscopy, we did. Everything was negative. So, to be honest, I am hard pressed to think that this is the problem. Okay? So, why don't I just send him over to neurology department? I believe is pretty empty right now. Oh no, actually not that empty. 3 people for 3 doctors, basically. Going to doctor, going to reception, examined. Um, but still, we have way more in the ER. So, I there's nothing really that can be clearly showing what we have here. Basic visual test didn't show anything. Ophthalmoscopy didn't show anything. Neck palpation didn't show anything. I don't think I can even do tonometry and the other ones. No, I couldn't because that's for the neurology. So let's actually go over to neurology department. I make the call. Not necessarily true, but we will see. And if we are already there, let's do a gonioscopy. Um, an ear exam, basically. Wait, why ear exam? Hold on. These are not ear exams. This is just a physical we already done. If you do a gonioscopy, should we do this one here? Oh no, this one's gonioscopy as well. I thought that there was one which is like the itching test. How do you call it? Skin allergy test, itching test. Okay. Yeah. I'm not even sure. Probably no need. Yeah, I'm just thinking that if we already sent him over gonioscopy, uh, let's. These are the other 2 that I could do right away. But the problem is that they need already the special neuroexam room. So it takes up a little bit more time. Let's do gonioscopy first and let him go there. Let's see what happens first and let's decide later. Okay, finally a simple case. Barbara Williams, unfortunately, is not one of our doctors, I believe. Yeah, she's not, but that's all right. So we don't know how many hidden symptoms are left. But I believe we haven't done a chest auscultation. Oh, we did. We did chest auscultation with that physical. Yeah, let's just treat him. Okay, finally one that we can just simply treat. Peter Baker, Elizabeth White. Okay, that's ours. Let's see, you have influenza A or B. Now, let's take a look here. What is your differential percentage? Uh, Elizabeth White, 1%. Okay. You know what? The quickest way to do it, I mean, not necessarily the quickest, but the easiest, is let's do a serologic sampling. We already did, we haven't done physical, so let's do a physical and then basically a serologic testing. Okay? Physical, well, you know what? If I ever do the physical, let me try to do a differential, but with my 1%, I don't think that it's gonna really show up anything, but let's try. Daniel Hernandez, okay, that's basically it's infectious or neurology, which means pretty much neurology, as we know, but that's okay. So we did physical, temperature, chest, speech, neurological, and basic visual, and we still have so many different things possible. Um, we cannot do any of those, tonometry, perimetry, whatever, without sending him to the neurological department. So let's try to see if there is anything we can actually speech listening we have done. Abdominal palpation, we haven't. Okay, let's do an abdominal palpation. It would show if it's an infectious disease. If it's not, then we should be much better. So you know what? Let's just do that. Maybe Daniel Hernandez. Let's remember that name. And let's see if we actually figure out what's wrong with you without going too far. Okay, this is easy. This is the only thing that you have, but we don't know what else you have. Physical, we definitely have to do to see all these. And that's pretty much it. So let's just do a physical. Michael Taylor. Okay, we have a lot of things coming on. Headache, muscle pain. I would say physical, neurological. And I'm gonna do a temperature test just in case. Okay. Frank Cole. Okay, clear diagnosis here. But we haven't done anything here. So we don't need an angiography because that would be just confirming this. So no need. USG would give you the same results. Thorax percussion, chest auscultation, and physical. So let's do a physical and the chest for now. Thorax percussion if necessary after that. Barbara Martinez. Okay, she's got some open wound, skin aversion, pain, but she's bleeding, hemorrhage. So we have to first, whatever happens, we have to give him anti-hemorrhagics. By the way, oh no, we are not, she's not our patient. That's annoying. Anyway, even if she's not our patient, we're gonna still treat her, right? So let's see. Physical, we need to do a physical to see if he has a basically infected wound. Other than that, she's fine. Only the hemorrhage is high. All of the others are like medium. We don't need to worry about it for now. So let's just do the physical. No, hold on. Let's do a physical. Sorry. Yeah, physical is on. Let's go to this guy. Asthma. Okay, but when you have asthma, you need to do spirometry. Really? We are going to need a bronchodilators anyway, so I don't think so. It would just basically, let you let you find out for sure that he has asthma. We have that. Speech listening we done. He doesn't need any of the antipsychotics or anxiolytics. No need. Thorax percussion would only give him analgesics, but actually, you know what? We need pain medicine. I mean, we don't know if we need pain medicine, so let's do that. Having said that, this is really an internal medicine affair, so why don't we take a look at the internal medicine here? How many people? 2 people, we have 3 doctors. Come on, get out of here. Go to the internal medicine. Okay, is there anybody I'm controlling at internal medicine? Unfortunately, nobody. Neurology, cardiology, and yeah, we don't have anybody, so that's fine then. Just whoever you find, that's fine. Okay, you just go to the internal medicine department, find whomever you want, and do a thorax percussion, and then you're good to go. Okay. Daniel Hernandez, what do you have? Okay, what did we do just now? Or was it just no? Was it just now? I think yeah. We did the abdominal palpation, which should have shown if he has infectious disease, but it didn't show anything. CBC testing, RT-PCR. Let's actually do an ophthalmoscopy because we can do it here. Some of the things we cannot do. We cannot do a gonioscopy. We cannot do a perimetry. We cannot do a whatever. But actually, we can do ophthalmoscopy. So I'm going to do that. Jessica Johnson, is it our doctor? No. That's all right. So let's do an ophthalmoscopy that hopefully, and maybe a neurology. We did that already. Oh, we did that already. Neurological testing. Okay, let's do that first and let's see where it takes us. By the way, guys, let me know in the comments if you can. Yeah, we're in the middle of the stream, so if you like this, don't forget to hit the like button and don't forget to subscribe. I still have a lot of more. Actually, I think for most people it's like that, and it's not even a bad thing. But I have about 70%, less than 70%, more than 70, no, less, about more than 60% of the people, and my watching time is coming from unsubscribed people. So if you like what you see, don't forget to hit the subscribe button. And as I said, please let me know either in chat if you're here, I don't know, or in a comment below which aspect of the game you like the most. Do you like the building part? Do you like this doctoring part, like what I'm doing? Or actually you like when you do management, which means, for example, I'm going to do that sooner or later, but first I want to make sure that everything is running as supposed to be. When you're going through, for example, your doctors, you are training them, you are replacing some people who have bad habits, and basically when you are doing management and trying to optimize the whole thing, which one do you think is the most interesting for you? Okay, please let me know if you can. Thank you. I like to read comments and I always try to make sure I answer all of them. All right, Elizabeth White figured out it was before us, before we started this challenge actually, but that's okay. It still should count that with the differential diagnosis, she actually figured out it's not A, it's B, influenza B. And so we don't need that serological testing because we're gonna get the antivirus anyway, and we already have physical, so I think we're good. Let's just diagnose. However, this time I believe, I'm not sure, but I believe I cannot relinquish the player control. I have to give the medication myself. So definitely we're gonna give antivirus, obviously. And we just simply check which one is medium or higher. Like we're gonna give him the antireplix, which is the fever medicine for sure. We don't need the rest because both of them are low. Sore throat, low. All of these are low. So let's not pump this guy full with all kind of medicine. Let's just give him what he really needs and let him go away. And let's see if we're gonna actually have on this left side here, if we have the first one that is actually counts towards the goal. I'm not sure. Otitis externa, okay, that's an intermedicine problem, which is a which is all right because this is not our doctor anyway, so it doesn't really matter. I mean, I could refer her to somebody else in this department, but that would be silly, wouldn't it? So, you, my friend, go over to the internal medicine and let's see what you're gonna do. We haven't done any kind of inspection, so if you do that, you might need diuretics if you have a edema. So let's double check on that. Let's do what is that? You see, this is the thing. Normally it would be like 1 or 2 pages. Now I have 8 pages to go through. Ear exam we have to do, I believe. Here, yeah, it would give you antibiotics. You already get them. You know what? You already get them. I don't need the ear exam. Maybe odometry would give you eardrops, but we already got that too. Fever, okay, that's relevant. Let's check if you have a fever. Because you're not telling me anything about that. Other than that, I think we're good. So, see you in the internal department, internal medicine department, sorry, internal medicine department. Okay, spinal stenosis for sure. Okay, that is everything is okay. Orthopedia, we don't even have an orthopedia doctor in our roster here. We should have had like one doctor in each department. Maybe that would have been a nicer thing to do, but whatever. Uh, there is nothing else we can figure out for you, so just treat you. Robert Foster. Okay, you've got fatigue and fever. Lisa Hall is not our doctor, is not one of them. That's okay. We're gonna get a physical. Let's do a speech listening. Let's see how high your fever is. Hmm. I think let's start with that. Let's not overdo it. The good thing is that what I like about this, that as long as the guy stays in the office, I can do one by one everything. Um, it would be ideal if I was actually watching him watching them doing all of that. However, the thing is, since I'm controlling every single patient, seeing it is not going to help me that much. But this helps me very much with all the patients. So that's why I don't do that. Otherwise, it could be, it's very cool, and sometimes I do it, one by one, seeing what they do, what kind of, how do they do the different exams. It can be actually a cool thing to do, and I'm going to do it sometimes. Once I manage to build the basics that I really want, and after that, once I optimize it a little bit, I hopefully will be able to um, start relinquishing my own responsibility basically and let the doctors handle things. And as they are handling things, I mean, sometimes I do this anyway, like to make money, to be honest. When they handle something, all of them, then I can just pick and choose 1 or 2 customers and just go through the whole, following them through the whole process, either controlling it myself or even just watching what the doctor do. It would be interesting to see sometimes when you have, let's say, something like a fever and just follow somebody just to see what the doctors are actually going to do about it all the way. Okay, ophthalmoscopy didn't show anything either. That's really annoying. Now, I'm afraid I probably do need to do. What is it? Let's see if there is anything that I can do here quickly. Abdominal, we did that already. CBC testing is big. Blood test, physical, yeah. What I'm talking about is that I want to see what I can do very quickly that hopefully tells me, yes, it is this, or at least it says, oh, it cannot be this, but I cannot see anything like that. Now, I could do, some RT-PCR testing and all of the serological CBC testing is suggested, but it's not really helping anyway, so what the heck can I do? Microbiome testing, I believe, is one of the tests. I'm not even sure that that's on the list. I have to double check because if I do something that is not even on here, it's just useless. Okay, you know what? What I'm gonna do is, because I really don't know. Okay, I already did a ton of different things for you, and it doesn't seem like there is anything I can really do here other than what we already did. I'm gonna send you over to the neurology department, and I'm gonna ask you to do a gonioscopy and a perimetry and a tonometry. Okay? And then let's see. Okay, Frank Cole, all right, we have you diagnosed. Chest auscultation didn't show anything. Physical did already. Thorax, we haven't done. By the way, this is the right department. It would give you just some pain medicine, and you already got them. And these two are definitely getting them anyway. Let's see who is. It's not my doc. It's not me, but that's okay again. I think let's just go and treat you now. I like to actually look around here and let's see if anything is medium or higher. I like to add that medicine just to make sure that they are all good. Okay, let's go to this one. Again, we know exactly what your problem is. Nancy Cole is oh, this is my patient. Okay. So we have to be careful with this one. And again, you see, we have everything available. Normally here, we would only have like one or two options, and we would know for sure that we're done. Physical, we already did. Tonometry could a medium level problem and give you eye drops. Um, Physical and microbial could give you antibiotic ointment. Do we need that? It's low though, so it's not a big deal. Oh, we already get you the antibiotics ointment. Sorry, so you get that for sure. Physical and the tonometry could help you, give you some eye drops that you already get anyway. I don't know, to be honest. Like if I find an ocular hypertension or something else that both of them having eye drops, it's gonna just show us eye drops. It's not gonna be like 3 different eye drops here. So I'm not sure if it counts that I'm like, okay, you already got eye drops, you can move on. Again, if you guys know anything about that, please let me know in the comments because I'm really interested in that. These are the questions that I always have. But for now, I'm gonna conclude. We already have a foolproof diagnosis anyway. So we're gonna give him that. We're gonna give him the antibiotic ointment for sure. Let's see, photophobia is kind of middle, so let's do a recommendation. Blurred vision, no problem. Eye pain, yeah, she's hurting, so let's give her pain medicine, and that's pretty much it. And eye drops, do we need? We don't. She just have red eyes, but who knows if That's the, you know. You know what? Let me, because we don't know if he has ocular hypertension. So actually, let's just be more careful than normal, okay? So let's actually give her a tonometry here. We are in the right department for that. And while you're getting all that, I'm not sure actually how it's gonna work. Are they gonna give him first these and then do that? But then basically you already treated the whole problem. So let's see how it works actually. I'm not even sure. Okay, deep wound on arm. We already physical examination actually clears it up. Good. Mark Johnson is not our doctor, so you know what? You just simply treat him, her, and get the money and just let her go. All right. Go to Charles Hill, who is internal, general, and emergency, all possible. Okay. He is throwing up, he has an abdominal cramp, and he has excessive flatulence. He's farting uncontrollably. Open the window, guys. Okay, so physical, we definitely give that. We're gonna do an abdominal palpation. Mm, let's check his temperature for now, and we move on. Michael Taylor, she checked his temperature, and guess what? He actually has necrosis. Oh gosh, that's not good. So Jane Green is not our doctor again. Gosh, we haven't got even one. Haven't got even one done, but that's all right. So we're gonna first of all we're gonna give you debridement. Let's see if there is anything actually we can figure out. A physical, we did give you physical. Blood test wouldn't do anything. So I'm just gonna go and let the doctor treat you. However, let's see, not just debridement, obviously, we're gonna give you all the other stuff as well. Just in case she wouldn't. NSAIDs, protective dressing is medium. Burn wound. Do I need her like burn management? That's what she's gonna get. Okay, Michael Taylor, right? So let's actually check Michael Taylor. I'm gonna check back in just 1 second. Let me see how it worked out because I already asked the doctor to do everything else. I just basically give him a couple of things that they might not give him. Okay, so let's go here. You have fatigue, elevated CRP. Okay, so he is actually in the hospital bed. Look at that. And again, we're still just trying to figure out what's wrong with him. However, now it's much harder because we have 5 pages of things. We already did 4 pages of things, and none of them was there. So it's getting a bit more difficult to actually find it out, especially in doctor mode. So good luck to us. And Christopher Jackson is not our doctor either. Okay. So what are we gonna do? What did the microbial? Oh, he's still. We already scheduled an ECG actually, and he's still having a urine analysis testing. You know what? Let's just leave him alone. He just finished one, and microbial cultivation didn't show anything, but he still has a ton of different possibilities. 24, I believe. But let's just go on because he still has a couple of them scheduled up, and we don't need to do anything with it. Waiting for player, chest pain. Okay, Donna Harris, I believe, yes. So you are our patients, and we still have 0 here. Let's try to see. Chest pain, we're gonna have, oh, we already did a ton of things with you, by the way. Yeah. Physical, chest, temperature, blood, thorax, speech listening. Okay, I think at this time, chest, I would say doing a chest, X-ray chest, I think is in order. I think it makes sense, right? I would do that. And possibly do an angiography. I'm thinking, or an ECG. Let's do an X-ray first, and then we might do an ECG there. Okay. However, first, how about this one? I'm just gonna do this. Just a quick check for you. All right. Peter Baker, you already have influenza B, we know, and you're done. Basically, he's done, right? Everything is nice and easy. Everything is either low or treated. He doesn't really have any other extra symptoms. He's already getting his antivirals. Um, let him go home. There you go. And I believe he is going home happily, doesn't he? Yeah, he's going to the pharmacy. So I think that was a good one. Again, oh, and we already have one. Wait a minute, Elizabeth White. Okay, so that was probably our first that we actually treated and works. All right, guys, here's the thing. I need to go. I started a bit too late this afternoon because I realized that I messed something really up with the Ostriv, the village building game, and I ended up streaming a little bit later than I wanted. So apologize for that. So this stream is a little bit shorter now, but actually that means that I have two streams on the same day, which is at the same time kind of not the usual. Let me save first because if I don't save, it can cause all kind of problems. You see, we haven't even gone through 1 hour because otherwise we would have an autosave already. So, uh, challenge on the way, just like that. Save the game. There you go. And I hope that you guys like what you see. If you do like what you see, please hit the like button, subscribe button, and come back to me. Come back as soon as possible. In the weekends, my schedule is a bit, not that fixed, but Monday to Friday normally I'm streaming in my morning, 8:30 to about 9:30 Taiwan time. Weekends, I probably still do that. Sometimes a bit later, like today, but basically in the morning. Evenings and afternoons are sometimes do, sometimes don't. So we don't know. Anyway, thank you so much for coming. Please come back next time. All right. Thank you and bye bye.